This is the Hear Me, See Me podcast. I'm your host, Melissa Bruner. Hear Me, See Me is a project of WIBW TV raising awareness of mental health and related issues. During February's Black History Month, I was able to sit down with two mental health providers in Topeka, both of whom are Black women. They wanted to share a message about why mental health is important for all of us. Well, they wanted to look at some of the challenges that stand in the way of Black people being agreeable to seeking out assistance for mental health issues. And they also talked a bit about access and representation and why all of that matters. We talked to APRN Angel Patterson-Tetuan. She is a provider at Stormont Vail Behavioral Health Care. Kenisha Morton also works for Stormont Vail. She is a licensed social worker. She works on the inpatient side over at the hospital. So they have two very unique perspectives. For Angel, she often has clients who are taking the initiative to seek out mental health care. And she shared her perspective on what she sees in that clientele. What do you notice in your own practice and profession and anecdotally when it comes to the patients you're seeing? What is the disparity between Blacks and whites and other populations?
I probably in my caseload have a handful of African Americans. I don't have many African American patients at all. The majority of mine are Caucasian. What
seems to be the struggle or where does that disparity stem from? And you can talk about the history, maybe is a good place to start.
The history is that African Americans don't trust the medical community. 1932, Tuskegee syphilis, project. They started doing that, and it took 40 years for that to come to light. So you have 40 years of people being treated and injected with syphilis. You're not going to trust the medical community. Whereas now it's changed. I mean, we have informed consent now. We have that you have to let someone know what is going to happen to them, what the side effects are. Every question that they have, you have to answer it. So they have to know what's going to happen. It's a lot more different now. So,
why is trust so important, in particular, in mental health care?
In particular, in mental health care, to get to what's wrong, you have to bare your soul, and you have to bare your soul to a stranger. That's very hard for anyone. So there has to be a level of trust for you to do that. I mean, you can't walk up to somebody on the street and tell them your life story. But that's what you have to do when you come to treatment. You have to walk in the door and tell the person you're sitting across from your life story.
And that's what mental health is all about. Are there some particular challenges that you find the Black community and people of color face when it comes to mental health?
I feel like it's different just in the fact that, ask me again, because I'm trying to get to there in my mind, and
it's hard for me to ask because I don't have that experience. And I think that's what you're getting at. Someone maybe who isn't living it doesn't understand it. What are the particular challenges that Black people face when it comes to their mental health struggles?
Many African Americans deal with trauma. Just trauma of growing up, trauma of experiencing life. I mean, I had a best friend of mine one time. We went to a wine tour in Paxico, and it's one where you go to a small town, you wait there for the trolley, and you go into the wine things. She said, "Oh, I love small towns." I said, "I don't." And she goes, "Why?" I said, "Because I don't know how they're going to treat me. I don't know if they're going to follow me around. I don't know if they're going to be just downright mean to me. I don't know who's going to accept me and who's not until they approach me." She goes, "I never thought of it that way." And I said, "That's privilege right there. I don't have that."
How did all of those experiences lead you to the behavioral health field?
My own family has extensive history of mental illness, so it was something that I've known from a very small, young age that I wanted to help. I wanted to shine light, let people know that there's people that understand. There's people that have been there. There's people who have been on this end of the tunnel, there's people who have been on this end of the tunnel, and you can get from here to here, and I can help you get there.
What we haven't even talked about the financial and economic aspect, because you mentioned that when we were talking earlier as well, that in addition to just the history and being able to build trust, what are the financial differences that you see, particularly in the Black community versus perhaps other races and ethnicities?
Most minorities find that getting care, especially mental health care, getting mental health care if you don't have insurance is almost impossible. Not in the fact of getting seen, because you can be seen. I mean, the hospital sees you no matter what. But for the care that you need, medication, you can't, medication's unobtainable if you don't have insurance. I mean, you could use GoodRx, but you're going to find that someone with bipolar, if they're being treated with a second-generation antipsychotic, you might find one second-generation antipsychotic that will cost you $18 a month. The one that the provider wants to prescribe for you might be $1,800 a month, because that's the way our system is here in America. It makes it unaffordable for people to get the care that they actually need, but they can sit there and tell you, well, you can treat them with this one. That one's not going to work for that person. It worked for this one over here, but it's not going to work for this one over here, because everyone's different. Everyone's chemical makeup is different. Everyone's genetics are different. So why are you telling me that I have to treat every one of my patients that doesn't have insurance with this medication when it's not going to work?
That's a huge industry-wide challenge for that. Yeah. So that aside, and being able to tackle that at the top issue, what is the message that you want people to know, people in the Black community to know about mental health?
What do I want them to know? It's about us in particular. I want them to know that we're here. I don't know that the community knows that we're here, and we're ready and willing to listen to their stories and understand their experiences and really hear them, because too many people think that they're never heard.
It is so important for people to be heard, and Angel did such a beautiful job expressing that message. Kenisha's experience is a little bit different, since she's a social worker and she works on the inpatient side over at the hospital. She shared what it's been like for her as a provider when there aren't very many providers of color around her. Is there a difference in how they react, Black clients versus white clients, when you first start to have those conversations with them?
Of when I first meet them? Mm-hmm. Sometimes, yeah. Yeah, and sometimes I think it can depend on the client, maybe the age of the patient. Sometimes, if I walk in the room, it's the fact, well, can I have a different provider? Or I've seen that happen with, different, I've seen that happen with doctors. Where I've seen patients ask for different providers. So versus when
you're seeing the flip
I
side.
see the flip sides of it.
Distrust of you.
Yeah, I've seen the distrust of me just when I just step in the room and say, "Hi, I'm Kenisha. I'm your social worker."
So when you have patients of color who come in, how do you feel like seeing your face can be a benefit to them and set the stage for healing?
I think that sometimes. I think it seems like that they are appreciative of that. Yes, because I've even had some that I've met with that have told me that they are happy to have a Black social worker, or happy to see a Black doctor in the hospital. Because I've had some that say, I've been to many different hospitals and I've never had a Black doctor, or I've never had a Black social worker, or I've never had a Black nurse.
How important is that representation in the care community?
It's very important. And as Angela stated earlier, it's important to see, to have that representation, and to have, to see people that look like us, that look like you when you walk into the hospital. It helps build that trust, and, to help the patient feel a little more relaxed And that way I can sit and talk to someone that maybe might have an understanding of what I've been through. That I can talk to you and I don't have to kind of maybe sit and worry about like, okay, maybe she's not going to know what I'm talking about. She's not going to understand what I'm going through. You know, she's not going to maybe deal with like maybe microaggressions that I've had, you know, that I've dealt with, you know, as I'm walking down the street or something, you know. So like she's not going to know. So
what message do you want to send to the Black community in particular when it comes to the importance of seeking care, and then also what they're going to find when they seek care? Because when you were talking about the trust issue, that's part of it. I don't trust that the person I see is going to believe what I'm saying, going to believe that it matters.
Well, the message I want to send is that we are here and we are ready and we want you to come in. We don't want you to hold anything in. We want you to come in and get help. You know, you do need to talk about it. We're here and we want to help you. There's no shame. There's nothing to be embarrassed about. You know, there are things like in our culture, like, you know, a lot of us grow up, you know, hey, what happens in our house stays in our house. You know, we don't talk about what's happening outside. We make sure we pray about it. You know, we give it to God, and that's how we take care of it. And which is good. And we keep those things and we have those things. We keep those, you know, we keep our faith and our values, you know, those are important to us, but we are here as well. So, and we want you to come in and come see us.
Kenisha's message is twofold, not just the importance of seeking out help if you are struggling with your mental health, but also if you have an interest in the field, no matter what your background, no matter what your race. Get involved, be part of the solution, see if this is a career that could be great for you so you can serve people in your community. She said that Stormont has job shadowing programs for folks in high school or in college. Seek out those opportunities to learn what the career has to offer. Mental health is important to all of us, and we appreciate Angel and Kenisha sharing that message. If you would like to seek out more information or find resources that could help you, go to WIBW.com/hearmesee me. We hear you, we see you, we're there for you.